This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now that's affecting emergency physicians and patients. I'm Laura Wooster. With increased attention on the issue of surprise bills in the press, as well as growing discussion around how to address this matter occurring in the House of Representatives, Senate, and the White House, last week ACEP released a framework of proposed solutions specific to emergency care to help ensure that patients are truly taken out of the middle of billing disputes and that access to high-quality emergency care can be preserved.
ACEP supports protecting patients from surprise lack of insurance coverage, and that's why we're working towards a legislative fix that expands patient protections for emergency care while fostering good faith negotiations between payers and providers.
ACEP President Dr. Vito Friedman held a telephone news conference last week announcing the solutions that include requiring insurers to more clearly explain emergency care rights to patients, prohibiting balance billing, and ensuring patients have only a single point of contact for emergency medicine billing by having insurers directly pay patient cost sharing to the provider. The news was picked up by several national media sources, including Vox, Modern Healthcare, The Hill, and MSN. To read the specifics about ACEP's proposed solutions, please go to the link at the bottom and stay with us as this issue continues to evolve. The White House's Office of National Drug Control Policy released the administration's 2019 National Drug Control Strategy. The president's plan seeks to address problems surrounding illicit drugs and substance use, especially the nation's ongoing opioid crisis. The strategy focuses on three elements: prevention, treatment, and recovery, and reducing the availability of drugs in America. Notably, the plan also calls for expanded use of prescription drug monitoring programs, or PDMPs, including looking into measures to incentivize states to make checking of PDMPs mandatory for all providers. ACEP has been active in legislative efforts to improve data sharing between federal and state PDMP databases, including the successful package of ACEP-developed legislation during the 115th Congress to facilitate sharing of prescribing information between the Department of Defense and state PDMPs. The Centers for Medicare and Medicaid Services, or CMS, released its Medicare Advantage and Part D Advance Notice and Draft Call Letter for the year 2020. CMS proposes to give Medicare Advantage plans more flexibility to offer supplemental benefits to chronically ill beneficiaries, such as providing home-delivered meals or transportation for non-medical needs. The Advance Notice and Call Letter also lays out several proposals for combating the opioid crisis. In addition, CMS proposes requiring Part D drug plans to place generic and brand-name drugs on separate formulary tiers. Furthermore, the proposal includes changes to plan payment methodologies that CMS estimates will increase plan revenues by an average of 1.59% in 2020. A small coalition of medical organizations, including ACEP, recently sent a letter to CMS asking the agency to modify its current policy around the definition of hospital-based groups. ACEP has commented on this policy for years. The group letter asked CMS to align the definition of hospital-based clinicians with other group definitions in CMS's MIPS reporting program for physicians, where only 75% of individuals need to qualify in order to receive the special status. Yet the current CMS requirement calls for 100% of a group's physicians to be designated as hospital-based over the prior year. If a group does meet requirements to be hospital-based, it will exempt them from the MIPS program's requirements to demonstrate usage of certified EHRs. To read the letter, please go to the link at the bottom of your screen. That's ACEP's Capital Minute for a busy first week of February 2019. I'm Laura Wooster. Thanks for joining me.